All right, let's dive right into this high-yield explainer on Japanese encephalitis. We've packed this session with everything you need to know for your exams, so let's get you ready.
We're going to tackle this in 5 logical sections. Think of this as your game plan for any question on JFE that comes your way, from the virus itself all the way to how we prevent it.
First up, Section 1, the basics. You got to know your enemy, right? These are the foundational facts that are perfect for those quick mark questions.
Okay, first things first, JEV is a Flavivirus. You have to remember that classification. It's an enveloped, single-stranded RNA virus. And yeah, it gets its name from being identified in Japan way back in 1871, but don't let the name fool you. Today, it's a major issue across Southeast Asia. Now for Section 2, and I want you to pay close attention here because this is an absolutely critical, high-yield topic, the transmission cycle. I could almost guarantee you'll see this pop up in your MCQs. So how do you remember all the moving parts in this cycle? Easy. We've got a great little mnemonic for you. PACMN. P is for pigs, our amplifier hosts. C is for the Culex mosquito, the vector carrying the virus. And MAN, that stands for man, the accidental dead-end host. This little trick is your key to the whole cycle. So, let's trace the journey. The virus doesn't just hang out, it multiplies like crazy inside pigs. They're the amplifiers. And it's kept alive in nature by waiting birds. Then along comes a Culex mosquito, usually Culex trianiorhynchus, and it bites one of these infected animals. And when that same mosquito bites a human, well, that's how we get into trouble.
So let's really nail this down because it's a super important point. Pigs amplify the virus. They get these really high levels of virus in their blood, but don't even look sick. Humans, on the other hand, we're what you call accidental, dead-end hosts. The amount of virus in our blood is so low that even if another mosquito bites us, it can't pick up the infection. And that means, and this is vital, there is no human-to-human transmission. All right, now look at this number, 1 in 300. This single ratio tells a massive story about this disease. And yep, it's a classic exam question. So what on earth does it represent?
Well, it points to this classic concept you have to know, the iceberg phenomenon. For every single patient you see in the clinic with severe Japanese encephalitis, there are around 300, maybe even up to 1,000 other people who got infected but had no symptoms at all. The severe cases you see are just the tiny tip of the iceberg.
Okay, let's pivot now to the clinic. Section 3, the clinical picture. What does this actually look like when a patient presents to you? After an incubation period of about 5 to 15 days, the illness usually unfolds in 3 stages. And yep, we've got another mnemonic to help you lock this in, PAL. It starts with the prodromal stage, which just looks like a fever. Then it can progress to the really dangerous acute encephalitis stage. And finally, there's the late or recovery stage, where we see the long-term consequences. And here are some of the hard facts, the numbers you absolutely need to have at your fingertips. In many parts of Asia, including India, J is the #1 cause of what we call acute encephalitis syndrome. The case fatality rate is terrifyingly high, around 20 to 40%. And for those who do survive, up to half of them are left with permanent neurological damage.
So your patient is showing the signs. You have a strong suspicion of JE. How do you prove it? That brings us to Section 4, confirming the diagnosis. This is another one of those guaranteed exam topics.
If there is one thing you remember for diagnosis, it is this. The gold standard test is the IgM-MAC ELISA. Finding those JE-specific IgM antibodies, either in the patient's blood or their cerebrospinal fluid, is the definitive way to confirm the diagnosis. Now, while ELISA is the star of the show, looking for the body's immune response, we do have other tools. We can also hunt for the virus itself using molecular methods like RT-PCR. This test looks for the virus's genetic material, its RNA, and it can be especially handy in the very early days of the illness. And that brings us to our final and maybe the most crucial section, Section 5, Management and Prevention. What can we actually do for our patients? Now, here's a classic trick question you might see. So take a second and really think about it. What is the specific antiviral drug that we use to treat Japanese encephalitis? The answer: there isn't one. Absolutely none. This is a massive takeaway point. There is no specific antiviral therapy for JE. All we can do is supportive care, managing the fever, controlling seizures, and providing respiratory support if needed. So if we can't treat it, what's left? Prevention. Prevention is everything. In this case, it really is the only cure we have.
So let's talk about our number one weapon, the vaccines.
Okay, this table breaks down the two main vaccine types you need to know about in India. Let's quickly walk through the differences. You've got the live attenuated SAW 14-14-2 vaccine. That one's given subcutaneously. Then you have the inactivated varicella-derived vaccine, which is given intramuscularly. Just make sure you know the different schedules, the routes, and the target age groups for each one.
Okay, we've covered a lot of ground. So if your exam is tomorrow and you can only remember 5 things, make it these 5. 1. The vector is the Culex mosquito. 2. The amplifier host is the pig. 3. Humans are accidental dead-end hosts. 4. Diagnosis is by IgM MAC ELISA. And 5. Treatment is supportive only, prevention is key. This is your ultimate high-yield summary.
And I'll leave you with one final thought, something to chew on for your Viva or your theory papers. This question connects all the dots from microbiology to public health. How can we break the cycle at its source? Thinking beyond just vaccines to things like vector control and managing livestock, that's where the complete answer lies. All right, that's our explainer for today. Good luck with your studies.